Hi everyone, this is JP Singh. I welcome you all on my channel Medicos Marathi. Hope you all are happy and healthy. My dear friends, today it's our third session for short 19 subjects. This session is targeting upcoming exam FMG NEET PG for year 2023. And before FMG exam, we are going to have one image session also. I will try to cover up as much image I can cover. So my dear friends, today here we are going to discuss questions of surgery, medicine and obsgyne. Okay, so let's start our today's session. Here we go with question number 1. Choose correct option for given instrument. So my dear friends, here the examiner given you instrument and it is a catheter. Okay, which catheter? Foley's catheter. So the correct choice here will be Foley's catheter. Option number A or B? The option number A is here correct choice. Foley's catheter of Tiemann type. Tiemann type. So this catheter is Foley's catheter Tiemann type. So the correct answer here will be option number A, my dear friends. Choose the correct option for this instrument. So you have to choose correct option regarding this instrument, and this instrument is green armitage forceps. This instrument is green armitage forceps. So my dear friends, let's go to next question. Which of the following is not criteria for preterm labor? एग्जामिनर क्या पूछ रहा है? Which of the following is not? Okay, is criteria नहीं पूछा, is not पूछा है. So cervix dilated more than 1 centimeter, yes, it is a criteria. 8 contraction in 60 minutes with cervix dilation, yes, it is also a criteria. More than 80% effaced cervix, yes, it is also a criteria. Cervix dilated posteriorly, no, it is not a criteria for preterm labor. Okay, we can see, we can note down 4 contractions in 20 minutes, 8 contraction within 60 minutes, and we will see that on per vaginal examination there will be more than 1 centimeter dilated cervix and 80%, more than 80% effaced cervix. Okay, and we can also note down cervix less than 3 centimeter will denote early preterm labor, cervix more than 3 centimeter advanced preterm labor. So my dear friends, here the correct answer will be option number D. Others are correct criteria for preterm labor. Which of the following is correct calorie requirement in 12 weeks pregnant woman? So for 12-week pregnant woman, the correct calorie requirement will be option number C. 400 kilocalorie in third trimester will be required. Okay, here you will see first trimester 0 kilocalorie per day. Okay, in second trimester 350 kilocalorie per day. Okay, in third trimester 450 kilocalorie per day. So 400 kilocalorie in third trimester will be required here. So the correct answer will be option number C. And we can also note down macronutrient like carbohydrate, proteins, fats. Energy requirement for this in pregnancy is 35 to 40 kilocalorie per day. Okay, my dear friends, and you can see carbs are 50% required, protein 30%, fats 20%. So my dear friends, now let's go to next. Which of the following is not estrogen dependent changes? You have to choose which of the following is not. You have to choose is not estrogen dependent changes. So here the correct answer will be option number A. Hair growth. Hair growth, it is not a estrogen dependent changes. Presence of estrogen in a pubertal girl stimulates the formation of breast development. Okay, production of cervical mucus. Okay, vaginal cornification. As estrogen increase, menses begins. Okay, so option number A, it is incorrect here. It is not a estrogen dependent changes, my dear friends. A woman present at 22 weeks for a detailed anomaly scan, the ultrasound reveals an amniotic fluid index of 11 cm. Which of the following is major contributor of amniotic fluid at this gestation? So here the major contributor will be option number B, that is fetal urine. So fetal urine, it is a correct choice here, my dear friends. And main source here, amniotic fluid. First 12 weeks ultrafiltrate of maternal plasma, 12 to 20 weeks transduate across fetal skin. More than 20 weeks fetal urine will be contributor. Yeah. What is position of uterus on postpartum day 2? Two finger below umbilicus, four finger below umbilicus, just above symphysis pubis at the level of umbilicus. So my dear friends, here the correct answer will be option number B, four finger below umbilicus. Two finger below umbilicus will be on day 1. Okay, so here the correct answer will be option number B. Size of uterus immediate after delivery will be just below umbilicus. Uterus become a pelvic organ by 10 to 14 days. Uterus become normal organ in 4 to 6 weeks. Rate of innovulation, it is 1.5 to 2 centimeter per day. HIV patient presented with diarrhea on stool examination following acid fast organism was seen. What is drug of choice in this patient? So drug of choice in this patient will be according to the condition. So here you can diagnose this condition is Isospora belli. Okay, this organism, this image given is of Isospora belli, and HIV patient which are present with diarrhea. The most common cause of this condition, diarrhea in HIV patient, is due to Cryptosporidium parvum. And here the diagnosis will be Isospora belli, and this condition is isosporiasis, and you can treat isosporiasis using TMP SMZ. So here the correct answer will be option number A. So my dear friends, now let's go to next question. Which valve of heart is enlarged first in patient with McCallum patch? Left atrium, right atrium, left ventricle, right ventricle. So my dear friends, here the correct choice will be option number A. Left atrial valve will enlarge first in patient with McCallum patch. In McCallum patch, the basic concept is regarding vulvulitis. Basic concept is regarding vulvulitis, and the valve which is going to enlarge is left atrium. A hypertensive patient present with grade 4 CKD with eGFR less than 30 ml per minute, doctor want to prescribe a thiazide diuretic. Which of the following will be best for this patient? So my dear friends, according to given condition, this is hypertensive patient and with grade 4 CKD, and eGFR it is less than 30 ml per minute. So according to given condition, the correct choice will be option number C, that is metolazone. Metolazone. Okay, so C is here correct choice. Combination of loop diuretics with metolazone is useful in patient with CKD stage 3 or 4. In advanced CKD, we usually encounter diuretic resistance. So that's why here we are using combination of loop diuretic with metolazone. So my dear friends, the correct answer will be option number C. A 10-year-old child had abdominal pain with melena. On examination, palpable purpura is found on calves and buttocks. Which drug will be used? So my dear friends, this palpable purpura, it is henoxacolin purpura, and henoxacolin purpura generally treated with steroids. So here the correct answer will be option number C, corticosteroid. So the treatment of this boy will initiate by corticosteroid. Okay, this purpura, it is henoxacolin purpura. So diagnosis of this question will be henoxacolin purpura, treatment will be by corticosteroids. An adult patient complains of palpitation. An adult patient complains of palpitation present with irregular pulse. Pulse deficit is 20, heart rate is 120 per minute, blood pressure is 110 by 70 mmHg. Which of the following will be found in this patient? So my dear friends, this condition irregular pulse and The parameters which are given here are representing that this is case of arterial fibrillation, and it will be denoted by absence of a wave. So here the correct choice will be option number A, my dear friend. A female patient complained of loosening of one tooth and hemi-facial pain. Patient was previously treated for COVID-19 4 months ago. Which of the following tests need to be done on priority basis? So according to condition of this patient, the test which is done is not given here in the option. But we have to choose one correct choice. And the correct choice here will be option number D, that is MRI of head. Okay. Ferritin level, ferritin test हम नहीं करेंगे because it is none of use, because ferritin it is increased in COVID patient, so we not do this. HbA1c का करने का कोई यहाँ मतलब नहीं है क्योंकि इसका कोई लेने देना नहीं है, ठीक है। नेजल स्वैब फॉर म्यूकर, नेजल स्वैब की जगह अगर यहाँ होता नेजल एंडोस्कोपी एंड बायोप्सी तो वो ऑप्शन होता करेक्ट, बट यहाँ पर दे रखा है नेजल स्वैब फॉर म्यूकर बिकॉज यहाँ पर कुछ फंगस जैसा कुछ दे नहीं रखा है, ठीक है, इन्फेक्शन जैसा कुछ दे नहीं रखा है, तो हम क्या करेंगे, नेजल स्वैब का हमारे पास यहाँ पर कोई यूज नहीं है, फेरिटिन का कोई यूज नहीं है। एमआरआई हेड कैन बी अ बेस्ट चॉइस हियर, बट अगर ऑप्शन में दिया होता नेजल एंडोस्कोपी एंड बायोप्सी, that will be better answer than MRI of head, my dear friends. Okay, so correct answer here is option number D. A patient presented with abdominal pain, blood in stool, and a palpable mass on abdominal examination. So, point to be noted: blood in stool, abdominal pain, and a palpable mass of abdominal examination. The following barium image was obtained. Okay, ये इमेज को बड़ा ध्यान से देखो, यहाँ पर सारा खेल ही इमेज को देखते ही क्वेश्चन का आंसर मिल जाएगा, ठीक है। द फॉलोइंग barium image was obtained from patient. What is most probable diagnosis? So here, after watching this image, it is looking like something spring, coiled spring appearance, and it is noted down in case of intussusception, and these following features are also seen with intussusception. Intussusception, it is most common ileocolic sausage shaped mass in the right lumbar region, empty right iliac fossa, spontaneous reduction occur, recurrent cases, small stool with blood. ओके यहाँ पर क्या लिख रखा है, ब्लड इन स्टूल। ओके माय डियर फ्रेंड्स, ऑन एक्सरे यू विल सी meniscus sign, target sign. On ultrasonography you will see target sign, pseudo kidney sign, ठीक है। Barium enema will show you class sign or coiled spring sign as given in image. So image में दे रखा है एग्जामिनर ने बेरियम यूज किया है, अगर बेरियम की जगह एक्सरे यूज करता तो दिखता हमें मेनिस्कस साइन, टारगेट साइन, अल्ट्रासोनोग्राफी यूज करता तो टारगेट साइन, स्यूडो किडनी साइन, लेकिन यहाँ पर एग्जामिनर ने यूज किया है बेरियम इनेमा साइन। अगर ऑप्शन में दिया होता क्या कोइल्ड स्प्रिंग साइन, वैसे देगा नहीं डायरेक्ट, ऐसे क्या देना, लेकिन इसने पूछा है क्या है इसका डायग्नोसिस, सो इंटूससेप्शन इज करेक्ट आंसर हियर माय डियर फ्रेंड्स। Patient present with halitosis and swelling in lateral aspect of neck, which on pressing give rise to a regurgitant sound. Barium swallow image is shown. Okay, here you can see barium swallow image. What is a diagnosis? So my dear friends, after seeing this image, the diagnosis will be option number C, pharyngeal pouch. It is pharyngeal pouch. Pharyngeal pouch, it is most commonly associated with esophageal diverticula, false diverticulum, mucosa and submucosa. Okay, most common symptom dysphagia, 75% cases of Janker's diverticulum. Okay, investigation of choice is barium swallow. So ये क्या है, pharyngeal pouch, most common इसका जो लोकेशन है वो esophageal diverticula, false diverticulum, mucosa and submucosa, most common symptom dysphagia, 75% of cases associated with Janker's diverticulum, investigation of choice है barium swallow. In a patient with parathyroid adenoma, how do we confirm the removal of correct gland after surgery? A patient present with Parathyroid adenoma. How do we confirm the removal of correct gland after surgery? So my dear friends, here the correct answer will be option number A. 50% reduction in PTH within 10 minutes of gland removal. Parathyroid hormone. Okay. According to Miami criteria for intraoperative parathyroid hormone measurement, drop of PTH into normal range and less than half of maximum value at 10 minutes of post resection. Okay. After resection, you will see there will be 50% reduction in PTH within 10 minutes of gland removal. So here the correct answer will be option number A. Child was brought to emergency with multiple injury which included a femur fracture as well. He was confused and dyspnoic. There was presence of rash all over the body. सो माय डियर फ्रेंड्स, इसने क्या बोला है? मल्टीपल इंजरीज। मल्टीपल इंजरीज मोस्ट कॉमनली वैसे कौन से इम्बोलाई में दिखेगी? फैट में दिख सकती है, एयर में दिख सकती है, क्या पल्मोनरी में दिख सकती है, या फिर डीआईसी में? सो माय डियर फ्रेंड्स, अकॉर्डिंग टू मी इट विल बी मोस्ट कॉमनली सीन विद इन द fat emboli. It can be correlated with fat emboli. Okay, so here the correct answer will be fat emboli. Fat emboli syndrome, it is a condition characterized by respiratory distress, altered mental status, skin fatigue. In above case, patient have present history of confusion, dyspnea, so it is a case of fat embolism. And you can also consider it by multiple injuries. Okay, so my dear friends, here the correct answer will be option number A. A 74-year-old patient with CAD and palpitation, ECG is shown below. BP is 120 per 84 mmHg. Which of the following shall be the best treatment for this patient? So my dear friends, this given condition is stable ventricular tachycardia. ये जो कंडीशन एग्जामिनर ने दे रखी है, ये क्या है? स्टेबल वेंट्रिकुलर टैकीकार्डिया. And generally, if stable ventricular tachycardia is present with heart problem, then you will use here IV amiodarone. ओके, अगर स्टेबल वेंट्रिकुलर टेकिकार्डिया प्रेजेंट है किसके साथ? हार्ट प्रॉब्लम के साथ, तो हम इसको ट्रीट करने वाले हैं किससे? आईवी एमिडेरोन से. अगर ये बिना हार्ट प्रॉब्लम के प्रेजेंट है तो हम इसको ट्रीट करेंगे बीटा ब्लॉकर से. अगर यहाँ पर होता विदाउट सीएडी तो यहाँ पर इसका ट्रीटमेंट हो जाता बीटा ब्लॉकर, लेकिन यहाँ पर दे रखा है इसने हार्ट इश्यू के साथ, तो इसका करेक्ट आंसर होगा ऑप्शन नंबर सी, दैट इज आईवी एमिडेरोन. What is diagnosis based on the image? You have to see this image carefully. Okay, from above to bottom. Okay, top to bottom. See the image correctly, my dear friends. What do you think? What will be the correct choice here? Here the correct choice will be option number D, imperforate anus. Here the correct choice will be option number D. An imperforate anus, also known as anorectal malformation, involves the lack of anal opening on the lack of proper size, abnormal location of anal opening which is present at birth. Congenital imperforate anus is considered very congenital condition. So here the correct answer is imperforate anus. What is name of investigation according to given image? So my dear friends, what is this condition given in image? First you must know this condition. It is bulbar urethral stricture. Okay, ये क्या है जो इस इमेज में दे रखा है? It is bulbar urethral stricture and it is investigated here by a technique that is retrograde urethrogram. So क्वेश्चन की इमेज क्लियर हो चुकी है. ये कंडीशन क्या है? बल्बो यूरेथ्रल स्ट्रक्चर, और इसकी इन्वेस्टिगेशन हमने किससे किया? आरजीयू, दैट इज रेट्रोग्रेड यूरेथ्रोग्राम. A chronic smoker, thin male, sudden collapsed and brought to emergency. Chest X-ray image is given below. What is next step of management? So my dear friends, what do you think? What is this condition given here in this image? My dear friends, this condition given in image, it is of tension pneumothorax. Okay, ये condition क्या है? Tension pneumothorax. Here you can see collapsing of left side of lung. Okay, and reaching toward mediastinum. My dear friends, this condition is tension pneumothorax, and generally tension pneumothorax, in tension pneumothorax we use large bore needle insertion. Okay, my dear friends. So this is a case of tension pneumothorax. Wide bore needle, it will be used in second intercostal space at mid clavicular line in children. Okay, children के केस में क्या है? Second intercostal space. In adults, it will be at fifth intercostal space at anterior axillary line. So ये कंडीशन क्या है? टेंशन न्यूमोथोरैक्स, और इसमें हम यूज क्या करने वाले हैं मैनेजमेंट, वो है लार्ज बोर नीडल इंसर्शन, या फिर बोल दो वाइड बोर नीडल, जिसका इंसर्जन हम अडल्ट में करेंगे कहां पर? फिफ्थ इंटरकोस्टल स्पेस पर, एक्सिलरी लाइन पर, एंटीरियर एक्सिलरी लाइन. A 23-year-old male had acute appendicitis 3 days ago. Now came to surgery department with abdominal tenderness. Which of the following incision is appropriate for condition? So पहली बात, पेशेंट किससे सफर कर रहा है? अपेंडिसाइटिस से. अब क्या हो गया? एब्डोमिनल टेंडरनेस. अब इसमें अप्रोप्रिएट इंसिजन कौन सा रहेगा? क्या ऑप्शन नंबर ए रहेगा? नो, ऑप्शन नंबर ए बिल्कुल नहीं रहेगा. अपेंडिसाइटिस और ये अबव रीजन का क्या लेने देना? ऑप्शन नंबर बी रहेगा. नो, मिड लाइन. मिड लाइन का क्या मतलब अपेंडिसाइटिस के केस में? ऑप्शन नंबर सी और डी. ऑप्शन नंबर सी और डी में सी है वो अप्रोप्रिएट है, बिल्कुल करेक्ट है, बिकॉज ऑप्शन नंबर सी, दिस इंसिजन इज मैकबर्नी इंसिजन. ओके, एंड मैकबर्नी पॉइंट इट इज चूजन when we draw a line, when we draw incision from in between the umbilicus and appendix. That is McBurney point. Like here you can see, this is McBurney incision. Okay, and generally a line is drawn toward umbilicus here. This is the McBurney incision here, my dear friends. Other you can also see here. Okay, incision, other incision are also given here. These are line given here. It is Kocher incision. Okay, transverse, midline. Okay, so my dear friends, here the correct answer will be McBurney incision. That is option number C. Following image is of. So what do you think? What is this condition? It is a MRI, it is a CT. What is this, my dear friends? So my dear friends, it is image of MRI. MRI of polycystic kidney disease. क्या यहाँ पर आपको मल्टीपल सिस्ट्स दिख रही है दोनों साइड? और ये किसकी इमेज है? MRI की है. किसकी? पॉलीसिस्टिक किडनी डिजीज की, माय डियर फ्रेंड्स. Opacities as shown in chest X-ray image indicate bronchiectasis. इमेज देखो ध्यान से, ठीक है. इस इमेज को देखने के बाद तुम्हें क्या लगता है इस क्वेश्चन का करेक्ट आंसर क्या होने वाला है, माय डियर फ्रेंड्स? According to this given image, the correct answer will be pulmonary metastasis. Here the correct choice will be pulmonary metastasis. Chronic smoker male present with pain in the finger with changes as shown in image, my dear friends. Most likely pathology in this image would be, according to this image, you can see that here are some dead tissues. The tip of finger, okay, are showing like that the blood supply is stopped here. And it happens in case of Buerger's disease. In Buerger's disease case, generally the small vessel get blocked and the blood supply not reach till the tip, and it will show the death of tissue. So that's why the color will change. In this case, the patient can also feel pain, patient can also feel tingling sensation, can feel many things. But according to this image, the correct choice will be option number A, that is Buerger's disease, my dear friends. So here the correct choice will be option number A. So my dear friends, this is about our today's session. Thanks to everyone. If you feel that this session is helpful, then do share this session, like this session, and subscribe to my channel for more updates. My dear friends, there will be a image based session before FMG exam, and I will try to cover up as more as image and important things which I can cover in that session. So thanks to everyone. Stay safe, stay healthy.